This is a video of the splinting and casting procedures produced as part of the Common Currency Project at the Dalhousie University Faculty of Medicine. There may be variations in the procedure from institution to institution, depending on supplies provided in the hospital, personal experience of the clinician, and clinical factors related to the injury.
This is a cast saw. It looks like a dangerous item, but it's actually pretty safe to use. It comes with a lovely guard that helps you gauge the depth. Now, when you start the saw, it's always good to give your patients a quick explanation, something like this. The saw makes a lot of noise. It vibrates. It's going to feel funny, but it won't cut you. What you'll feel is it coming across here, but not to worry about it. Don't jump. You just got to trust me. And then what we usually do is a little demo where we take the saw and put it to our skin and show them that it won't actually cut them. So what I'm going to do when I start, I'm going to use my finger for a gauge to see how far I'm going in. So you're going to start and you're going to roll the blade, and as you go in, you're going to be able to slide. So it's a sliding motion. You're going to go in and out, but you're going to rock it. The blade itself actually vibrates, so you're actually only using this cutting surface the whole way through. So it's important to keep your blade sharp and to rotate it probably at least once a week, depending how many casts you cut off. As the sharper it is, the quicker the cast cutting is, and the less chance you'll have of burning a patient or struggling with a cast. First, what you're going to do is make an incision down here. You're going to trim off this little area here, and then you're going to ask the patient to go up on elbow, and you're going to bring the saw up right along here, and then you're going to split it. The drier the cast is, the easier it is to cut. When it's wet, it might take a little bit more to get through, and it might stick a little at the end when you're splitting the cast. So what we're going to do now is start with cutting our cast. With your settings, you'll want to keep it on the low end. So you want to have it on 1 rather than 2. 2 is good only for fiberglass, just because it is a little faster and it cuts a little quicker, and you don't need that with plaster. So you're going to start in here. You'll be able to feel the change from the plaster to the padding. And what you'll want to do is take your other hand and support underneath just to give it a nice contrast. So you're going to go in with your rocking motion. Slide it back and forth, keeping your finger on the back end for a gauge. Then you're going to come up here. You're going to hold it nice and secure. You're going to have this other hand here for a gauge as well. You're just going to slide in there, taking it nice and slow and easy. The other test you can do to know that you're through, just a little push. If it moves, you're through most of the way, if not all of the way. So what we're going to do is get them to go up on elbow now. You're going to start along the bottom. We're going to keep your other hand running alongside for balance and support. Keeping the back finger in there for a depth gauge. And your cast is off. You can keep them in this position. You'll take your splitters, you'll slide it in there. Just a nice firm little split. You might need to do it twice just to make sure it's separate. And you'll get them to rest down. Just relax straight there. Perfect. And what you'll do is use your fingers to spread a little bit more. Yeah, just relax. Just let me do all the work. You'll take your scissors. You'll slide it just above the skin, just under the padding. Slide them up. Going slowly and carefully so you don't poke them. Then what you'll do is grab a hold of the thumb, Slide your finger under the wrist. Just tell them to hold still. Let me do the work. Give them support right under here. And slide them up. Get rid of your cast. And usually put something down underneath just to support. A pillow would be good. Or you can take a towel, especially if it's a Colles fracture. What you'll want to do is have them angled down slightly and relaxed. Then you'll get a cloth, clean them up before you prepare them for another cast.